You need to be careful when it gets this steamy out. Dr. Jeff Sternlicht with the Emergency Medicine Department at GBMC joins us now with some reminders about what we need to know when the temps go up. Hi, Dr. Sternlicht. How are you?
I'm great. How are you?
Good. So, I mean, obviously we hear a lot of the warnings out when the temps go up like this, and they seem pretty common sense. But yet, you probably do see a lot of people still coming in with heat-related illnesses.
Correct, we do.
What kind of illnesses are we thinking?
This is the time of year we typically see it. So it's usually the first heat of the year, and that's when people have not yet acclimated to the temperatures. So later in the summer, after people get more used to the heat, you see less of this. But it's usually this first heat wave of the year where we see most of this. And we're seeing the spectrum. It's usually people who are outside working in the heat, either working in the heat or playing sports or athletics, cycling, running, those type of things, and come in with symptoms such as fainting or nausea or headaches or dizziness, fatigue, more severe things such as confusion or even seizures.
So we hear the terms heat exhaustion and we hear heat stroke all the time. Explain what the difference is between the two.
So the difference is heat exhaustion is more of a cardiovascular problem. So that's when one is not able to maintain their cardiac output secondary to their exertion and the heat, because the heat causes compromise on the cardiovascular system. So that's what heat exhaustion is. Heat stroke is more serious because that's when you add neurological components. So in that case, your temperature is usually high enough, usually over 104, and you have neurological symptoms. So those symptoms could be from more mild confusion and irritability to something as severe as coma or seizures. But you need to have the neurologic problem that defines heat stroke.
So when do we know that it's time to go to the hospital when we're feeling kind of some of these symptoms?
Best approach would be to, when you just begin to feel symptoms, to get out of the heat. So as soon as you start to feel nausea or fatigue or anything like that, get inside, get into a cool air-conditioned place, get out of the sun, get into the shade, drink cold liquids, and those type of things. So your best to do very early on. So if you faint or you pass out, that's definitely a reason to come to the hospital. If you're with somebody who's confused or not acting themselves, that's a reason to bring to the hospital. Excessive vomiting is another reason. So things like that. But people are best off trying to get to the warning signs early on before it's actually too late and they actually have to go to the hospital.
Well, let's talk about that a little bit. Preventative measures. What can we do to, help our chances of not getting heat stroke or heat exhaustion?
Well, first of all, be aware that it's a problem this time of year. So being prepared and knowing that you shouldn't be outside for a very long period of time. You shouldn't be exerting yourself for a very long period of time. So short bursts of this and acclimatize yourself over the season, knowing you're not going to be as prepared early on. Second is wear the appropriate clothing. Wear lightweight, light clothing that's going to keep you cooler. Third is make sure to stay hydrated. Drink plenty of fluids, drink plenty of cold liquids, drink frequently, and drink a lot. And then next is just be aware of your medical history and your medications. So many medications will increase your risk for heat exhaustion and heat stroke. So if you're on medications, be aware that you're at greater risk. And if you have chronic medical conditions, cardiac conditions, neurologic conditions, things like that, you're also at increased risk. And the extremes of age, the elderly and the very young are also at increased risk compared to the healthier age ranges.
All right, Dr. Jeff Sternlicht from GBMC, thank you. A wealth of information, things that definitely we need to be reminded of when the temperatures go up. Appreciate you talking to us today.
Thanks for having me.